So much going on also at the federal level, and I'm deeply concerned about that. I know a number of people that are running for Congress today, and while my family and I determined that with a 10-year-old and a 13-year-old it wasn't the right time, it doesn't mean that we aren't looking at what the federal government is doing today with great concern. Not only did the stimulus package move us in the wrong direction, it didn't produce economic advantage for us, it put our children in great debt. We have now ballooned our debt to China and other countries, and we've got to slow down the government printing presses and the borrowing that's going on in Washington. There are two issues, however, that are going to directly affect you as Virginians and will also affect the General Assembly. First is the cap and trade legislation. Clearly, this bill has something to do with the environment, but it has more to do with moving us toward a system where we make sure we rely more and more and more on government. Over my many years, I've had the opportunity to work in the energy sector, and I understand that sector very well. The net effect is that we are going to cap, if the bill passes, the amount of carbon that may be put out by each organization. And if you want to grow more, if your business wants to grow more, you're going to have to actually go out and buy carbon or be taxed for that additional growth. I'll tell you, Virginians, this will hurt economic development more than anything I've ever seen in Virginia or at the federal government. We've asked our lawmakers here in Virginia not to pass the cap and trade, not to put this tremendous tax on all energy that's used. I'm concerned, of course, that the Obama administration seems that they're committed to doing this, whether it's good for Virginia or not. The other issue, of course, relates around health care. The Senate and the House, at least the majorities in both, seem dedicated to health care. And I guess if you live in Nebraska or Florida or some of the other states, they're going to get a little more economic benefit out of this than we are here in Central Virginia or entirely of Virginia. I'll tell you, I think this is one of the worst things government has ever done. Most Virginians are very pleased with their health care. They get good health care from good professionals out there. But this bill is going to eventually move as many people as possible to a Medicaid or Medicare type program. And while those relatively smaller programs have barely been able to keep afloat, there'll be a rush of new individuals to those programs. Next, it will not, in the end, be cost neutral. This is going to be extremely expensive to the U.S. Treasury. But what is overlooked is that it passes a big responsibility on to state government in the form of a mammoth mandate. Now, those senators from Nebraska and other areas that were able to keep the offsets high in their state, the impact on state government will not be as great. But for you, Virginians, the impact is going to be tremendous. The next will be access to care. We have had the opportunity to have good health care in Central Virginia, and we've been able to have good doctors. Now we're going to go in with price controls and telling doctors what they can and can't do to serve you. The net effect is I think we're going to have less health care available and more people trying to access that care. The other is as you know, I've worked for years to try to do something about the out-of-control litigation on physicians. And this bill does nothing on that major issue. We're going to be working this year in Richmond to try to come up with legislation that helps, but this federal bill will actually do much damage to our work that we've tried to do here in Virginia. So while Virginia moves forward this next year with the budget difficulties and otherwise, we're looking to Washington mostly just to leave us alone. Mostly to leave our families alone. Allow us to have the high quality of health care that we have today. Don't put a massive tax on all energy that's used in Virginia. And certainly don't stop economic development during a recession.